Hello, everyone, and welcome to this presentation on the Public Health Service Council of Ohio, FSCO, Emergency Planning Position. My name is Mike Schultz, and I'm the lead planner and coordinator for the Emergency Planning Program. Over the next 5 minutes, we'll be getting an overview of the FSCO planner position, the interactions with local health departments, a general overview of the Public Health Emergency Preparedness Grant, and cover some of the differences between public health emergency preparedness and emergency readiness management. Welcome, and let's get started. Let's take a look at the overview of this presentation. We'll go over the purpose of the position, the liaison connection, public health emergency preparedness, or PHEP, and emergency readiness and management. These 4 areas constitute the FSCO Emergency Planning Program. The purpose of this planning position is to support the emergency management and readiness needs of local health departments and partners. Our role is to be a guide and subject matter expert for emergency and disaster situations, planning, and help in creating a more intuitive and manageable process. This is accomplished by supporting local health departments and partners with plan building, exercise design, training, education, reducing staff workload, safety planning, improvement planning, coordination of goals, project management, outreach, and supporting outcomes related to their emergency preparedness and management program. Now that we are aware of the purpose of the emergency planner's position, we wonder, how does that interaction take place? The FSCO planner is a guest and works within each agency looking to support their needs and be a guide for process development and improvement. For this to be successful, an agency provides a liaison to the planner. The liaison and the planner work together in the development of the agency's emergency preparedness and management program. These 2 individuals will have many interactions, such as designing exercises, creating messages for their agency and community, promoting emergency preparedness and management, development of training, and engaging in the development of their desired emergency management program. Some of you may have heard the acronym PHEP, which stands for Public Health Emergency Preparedness. This program is overseen by the Centers for Disease Control and dispenses all money and requirements down to the state, which then moves down into local health departments. This program has gained its footing after 9/11 and since then has been a cornerstone for funding and planning across the state of Ohio. The PHEP program is a grant program, and with that comes deliverables we are required to complete and submit to the Ohio Department of Health. Deliverables range in size and the amount of time it takes to complete. Some deliverables are very straightforward, such as tactical communications, which requires getting information from another agency or sending a message through one of our communication systems. Although, deliverables can be a little more complex. For example, building the emergency response plan, the radiation plan, writing after action reports, or the medical countermeasures plan. The intent of this grant is to promote planning within the local health department, reaching out to their local, regional, and state partners. The grant continues today and has changed many times, but its goals and outcomes remain the same. That goal is to have local health departments that are ready to respond and operate during emergency and disaster events. Here we see planning activities taking place behind the scenes. These are critical for PHEP programs and coordination. All local health departments have experienced some sort of emergency or event that requires a response operation. Saying this means that there is some difference in how we see preparedness, readiness, and management response. Allow me to share these unique differences. Preparedness is the larger picture for best practice, research, and creating an emergency program. Readiness planning is the development of the people and the specific processes that may be used during an emergency, governing the way we respond, make decisions, and apply preparedness, readiness, and management planning to the situation. Even after hearing those explanations, you may have asked yourself, what's the difference? In some ways, the differences are very few, but there are 2 different conceptual stages of emergency planning and management activities and actions that create a successful response. Here are a couple of examples of preparedness and readiness activities. In that top photo, you'll see law enforcement assisting public health with transportation of resources. And in the bottom photo, you will see what is a full-scale exercise for a point of dispense clinic. partners are critical and essential to the success of all response operations. I want to thank you for viewing this overview presentation of the Fiscal Emergency Planner. If you have any further questions, please reach out to your liaison, Brian Heil, or speak with Commissioner Gerken about communication with me. My greatest appreciation for your time and efforts. Have a wonderful day. Thank you.